PA. I'm in my third year of my second 4-year term on the commission, and I'm looking forward to hearing your thoughts and comments and questions as we go.
Good morning. My name is Teresa Schimmels, and I am also in my second 4-year term, and will actually be replaced this year. We have quite a few applicants for my position within the commission. I hope to continue serving as a pro tem commissioner for a couple more years. I work at the Spokane VA hospital, but I've been active in legislation through Washington State really since I was a PA student and an early pro tem on the PA Rules Committee within the Washington Medical Commission when it was MQAC, and then again when we opened the rules about 8 years ago, and now again with this legislative change, as well as work with WAPA.
No one can replace you, Commissioner Schimmels.
Oh, maybe.
I am Ariel Page Landstrom. I am a supervising staff attorney with the commission. And good afternoon, everybody.
Back to you, Jimmy.
No, my computer is having a moment unmuting itself, so I apologize. So today we are going to go over the practice agreements, the changes to that, the changes to remote sites, changes to supervision requirements, how osteopathic PAs are going to join our great commission, and discuss the long-term implications for your practice. So hopefully at the end we'll have ample time to answer your questions, but those are the big topics we're going to be covering today. So what's new? House Bill 2378 is titled Concerning Physician Assistants, and it was passed in the 2020 legislative session. And over the past year, the WMC has been conducting rulemaking in order to implement this bill. I'm going to pause here for a second and let Ariel kind of explain the difference between the bill and the rulemaking process.
Sure. So as Jimmy said, Substitute House Bill 2378 was passed by the legislature last year. And there are two main areas that the bill covers. One is changes to practice agreements between supervising physicians and physician assistants. And the other area is combining the allopathic PA credential and osteopathic PA credential into just one, and PAs will now be, all PAs will be regulated by the Medical Commission. The bill, the legislature gave authority to the Medical Commission to adopt rules in order to implement some of these changes. And so the Medical Commission is currently undergoing rulemaking now. Most of the changes in the bill will take effect July 1st. The changes in the rules we anticipate will take effect in September of this year. So that leaves a bit of a gap. And so what we recommend is that PAs, if you're looking, or supervising physicians, if you're looking for, how do I know what law or rule to is in effect, look at the statute or law in chapter 1871A until the new rules are in effect. That will tell you what law to follow until the new rules are in effect, and then you'll use both. You'll use both the laws and the rules.
Thanks, Ariel. Okay, so our first topic is the changes to the practice agreement. So the big one is practice agreements are replacing the name of delegation agreements. And the Medical Commission no longer needs to approve your practice agreement before you can begin practicing. However, before you begin practicing, we do need a copy of that on file. And For your convenience, we have an online portal that acts as a one-stop shop where it has all of the requirements of the practice agreement and a place for everyone to sign, and it gets automatically routed to us, and then you're done. However, you do not need to use that if you do not want to. Your organization can submit an electronic version in whatever format that you choose. It just kind of has to follow the requirements, which we'll talk about in the next slide. But just so you know, you can submit your own practice agreement, but that online portal is a one-stop shop for you guys. If you choose to use your own format, a model practice agreement is available on our website. If you choose to use our practice agreement, the online form, and you need to make a change to the supervising physician or any other technical change of that nature, you can file an amendment with us rather than having to complete a new practice agreement. So that option is also available on our website with the portal. And there is also a termination form on our website to help you if you need to terminate a practice agreement for whatever reason. It's a simple form and you can just let us know. If my panel has anything to add to any of these slides, please feel free to jump in.
The big thing is to make sure that if you terminate your practice arrangement with your physician, to make sure that you send the termination agreement form to the medical commission so that we know what you're doing and where you're moving next. Oftentimes what happens is we will see that a physician assistant is apparently working at 3 different offices, but the doctor no longer has a Washington State license, or they've moved on from that practice. So it's really important to make sure that when you move to a new job, that you file a new practice agreement and that you do a termination with your previous supervising physician.
Can I just add one thing too? Just to be sure to avoid confusion, I think the second item here, WMC will no longer approve practice agreements for a PA to begin practicing. I think that's well worded. Although I want to make sure nobody goes away from reading that thinking then, well, then who will? Or why is the commission no longer doing that? Who will approve them? And really, the practice agreements no longer require approval from anybody except the people who are creating the agreement themselves. In this case, the PA and the supervising physician.
So now I'm going to get into a little bit of the technical aspect of your practice agreement. Like Mr. Anderson said, we are not approving these, but there are still requirements that must be laid out and agreed to upon by the parties. So the high level aspects of this are, in your practice agreement, you must outline the duties and responsibilities of the PA, the supervising physician, and any alternate physicians. Your practice agreement must describe supervision requirements for specific procedures or area of practice, and then the process between the physician assistant and the supervising and/or alternate physicians for communication, availability, and decision-making when providing patient care. There's also a provision that a process needs to be laid out for communication when there is an acute health care crisis, not previously covered by the practice agreement, such as a flu pandemic or other unforeseen emergency. If there is only one physician party to the practice agreement, a protocol for designating alternate physicians for consultation must be outlined. And all mentioned parties must sign that they agree to the provisions in the practice agreement. And there also needs to be a termination provision. So how are you going to communicate when this practice agreement is no longer in use? So our next big topic are the remote sites. We do not need to approve PA practice in remote site because the phrase remote site is no longer in the new statute. The remote site provision no longer needs to be documented in the practice agreement. The organization can implement their own system for communication or procedures or procedural aspects for remote site practice, but it does not need to be filed with the WMC. And then if a PA has a limited license, they can practice in a remote site, but again, make sure that that needs to be in the practice agreement if the PA has a limited license.
You know, oftentimes PAs have questions about what's a remote site, and a remote site is any place that you're practicing that is not in the same place where your physician is practicing. So for me, I used to work at Rockwood Clinic in Spokane downtown, and I worked 2 days a week at the Spokane Valley Specialty Clinic and office. And so that was considered to be a remote site because my doctor did not go out to that site. So it doesn't have to necessarily be a remote site like you work in Spokane and then maybe you work in Chewelah or you work in Davenport or somewhere like that. Remote means just away from where your home base is with your physician.
And then our next topic is physician supervision. So there's a change to the number of PAs a physician can supervise, and that the current maximum is 5 PAs. The new limit is 10 with a waiver. That waiver is also available on our website. That waiver hasn't changed as a result of this bill. So it's the same waiver, it's just the new limit's 10. The geographical location of the PA and the supervising physician is not something the commission is necessarily going to regulate anymore. It's really coming down to whether the supervision was adequate. And being at a different site than your supervising physician could definitely affect the ability to maintain adequate supervision. And so as the PA and the physician, it's up to you to make sure that there's adequate supervision and communication happening between in that relationship. Okay, so osteopathic PAs. The big change here is after July 1st, there are going to be no new DOPA or Dopa licenses. When it is time for you to renew that license, you'll renew with the WMC and you'll get a PA license. DOs are currently on a 1-year cycle, so once you have your PA license, you're going to be on a 2-year renewal cycle. And you do not need to have a separate license to work with a DO anymore. You can have either a DO or an MD as your supervising or alternate physicians, but it's just going to be one license type on a 2-year renewal cycle, and you'll file regardless if whether your supervising or alternate physician is a DO or an MD, you'll still file that practice agreement with us. So we're just trying to simplify practice here in terms of having one license type. You don't have to pay, you don't have to worry about different renewal cycles or licensing fees or CME requirements. It's going to be one license type starting July 1st. So just kind of hitting on what I said, the long-term implications of this is there's one license type. We're trying to make your lives a bit easier. There's broader supervision, less oversight, and fewer barriers to getting to work. Once you have that practice agreement filed, you are good to go. So those are kind of the long-term implications. We're going to do a frequently asked questions section next, but I'll pause here to see if anyone wants to add it, if I had forgotten.
I mean, I'd just like to say, you know, we were working on this when I first started on the commission about 8 years ago to try and combine the DO and allopathic PA into one license. We did refine it and we made both of the license applications. the same. So this is really exciting, and I think it's going to get rid of a lot of confusion. Your practice plan can be signed by an MD or a DO. It doesn't matter now. And you don't have to pay 2 fees. So it really, I think, is going to really simplify a lot of people's lives, especially since we're seeing a lot more DOs in primary care primarily.
So we'll just go into our FAQ, and then we'll have kind of an extended, I see lots of questions coming in the question portal, so thank you. We're going to run through this, and then we'll get to some of those specific questions that you have. So the first FAQ we've been getting recently is, how long do you have to wait to begin practicing? So assuming you have a job, as soon as that practice agreement is on file, you can begin practicing. You don't have to wait to hear back from us. Just send it to our medical.delegation email box, or use our online portal, and you're good to go. So, do I need to file a new practice agreement? The answer is no. So everyone that currently has a valid practice agreement, you'll kind of be grandfathered in. So if you're a DO, you have a practice agreement with a PA, you do not need to file a new one. We'll just kind of accept those in our new scope, but that is assuming that nothing has changed. If your scope of duties have changed, you'll need to file a new practice agreement with the commission. So as long as your scope of duties have not changed, you can keep your old practice agreement. And once you renew your license to have that PA license type, you'll need to file an amendment with us, just so that we have your new license type on file. That amendment form, it's a short 1-page form on our website, and it's basically just notifying us that you've received your new license number.
And I'd just like to add to, just to clarify, the file amendment is only with the DOPAs when you get your new license after your renewal period pops up for the new, into the new rules.
And just to further clarify, if you're a PA who has not had an agreement with a DO, you've had an agreement, an allopathic agreement, then your number will not change. The only people whose numbers will change are people who are now DOPAs and are soon to be PAPAs. Is that correct?
That's correct.
Thank you.
So our next FAQ is, do I need to find an MD supervising physician? The answer is no. Now, you can have either a DO or an MD as your supervising physician. They can sign off on the practice agreement. That difference isn't front and center anymore. So no, you don't need to find an MD to supervise a DO. You can have either as your supervising or alternate physician. And then our last FAQ is something that's a little out of scope of this presentation, but I wanted to make sure everyone is aware of it. If you practice telemedicine, we want to make sure that you know at the end of this month, if you practice telemedicine, you have to complete a telemedicine training. And in the law, if you are delivering healthcare services through the use of interactive audio and video technology for the purpose of diagnosis, consultation, or treatment, according to the law, you are practicing telemedicine. And as a PA, you need to complete a telemedicine training. The Washington State Telehealth Collaborative, on their website, they have the training. They have different training options, whether if you're, are you an in-person or virtual, and they're all free. So just this slide deck will be available online on our website. So click on that link, and there's a bunch of free resources there for you. So just something I wanted to make sure everyone knew. Okay, that is the end of our formal presentation. So we can open it up for questions. I'm just gonna kind of read some questions that came in early.
Jimmy, this is Amelia. I'm working on the one about virtual care.
Okay. So does the limit of a 10-to-1 PA MD also cross over to remote sites that is listed as unlimited?
Can you read that again?
Sure. Does the limit of a 10-to-1 PA MD also cross over to remote sites that is listed as unlimited?
Yes,
Well,
I believe it did. And wasn't it, or was it a limit of, it used to be a limit of 3, but I don't think it's any, I think it's all included in that now.
the remote site language is removed from the law, but the limit is 10, but a physician still can only supervise as many physician assistants as they are capable of doing. So if that is in a remote site, they need to think about whether they can do that in a safe way. So even though the limit is 10, if that's in a remote site, they need to think about whether they can supervise those PAs and do it in a way that is safe for patients.
Absolutely good point, Ariel. And so you're certainly not going to want to, you're going to want to really consider signing a practice agreement with someone if you're going to be, if that doc has 6 PAs and they're at 6 different sites. Because there's only 5 days a week. You got to be able to have a little bit of supervision, or at least have to have contact. So you want to make sure that you're in a safe practice environment as well, and that you have access if you need it.
Ariel, I have a comment or question. I mean, certainly you can, what if all of these new procedures from now until the end of time, but I don't mean to do that. But I have heard this question. I'm not sure I know the answer myself. So what if that doesn't occur? What if the supervising physician has 10 remote site PAs, but they're really they're not able to manage that? So that if I think the answer is the same thing that happens now. If somebody saw that and had a concern about it, and if they complained to the commission and the commission investigated and said indeed it looks like there's really not meaningful supervision going on, then that would be a violation of the Uniform Disciplinary Act. It's just like in any other complaint that comes to the commission where we decide whether it is or it isn't. Is that correct?
Right. So the language, this new language says that a supervising physician may not supervise more physician assistants than the physician is able to adequately supervise. So even though we have this 10 physician limit, and we actually can grant a waiver, but there's the supervising physician still has to be able to adequately supervise however many physician assistants they are supervising. So things to take into account would be a remote site circumstances. If however many physician assistants they are supervising, if all of them were remote site, what kind of checks are in place? Are they checking their charts? Are they checking in with the physician assistants regularly? All those kinds of things. But yeah, if we're getting a bunch of complaints, those are things to consider. But the language is the supervising physician has to be able to adequately supervise however many physician assistants they are supervising.
And I guess if the question is, well, who is to decide whether they are able to do that? I think the answer is the Washington Medical Commission.
Yeah, it would depend on the circumstances and the complaint or complaints that we get.
Sure. Thank you.
Another question we have that I forgot to bring up, so I'm gonna bring it up so everyone can answer. If you have both a DOPA license and a PA license, will you just default to your PA license? And the general answer is yes. So when your DOPA license is up for renewal, you just won't renew it. You'll just keep the PA license that you currently have and not renew your DOPA license when it's time to. So another question we have is, in our organization, we have a DO supervise a PA. However, they would need to have an MD as a partner for supervising. With the update, is there any need for an MD oversight, or can a DO take sole responsibility for PA supervision?
I believe the answer is yes.
That's correct.
Yay! Ding, ding, ding. Ring the bell.
Just, you guys are the
Yeah,
experts.
I mean, that's just another example of about how the new law really, in many ways, streamlines and makes the process more efficient.
Okay. So for minor office procedures, my PA does 1 or 2 procedures I have not done in the past, as well as the inverse. Does that run into scope of practice issues?
I think the answer is yes, it does. I think that the Uniform Disciplinary Act, which guides the work of the commission and overseeing cases that come to us via complaints, holds that for there to be meaningful supervision, the MD needs to be familiar with and skilled in everything the PA does. And if the PA is doing something that the MD, the supervising physician, is not skilled at, and if the activity of the PA is outside the scope of the MD, that's perilous and is not consistent with what the expectation is.
So is
think
the clinic that, oh, sorry, go ahead, Ariel. I'm sorry.
I was just going to say, I think it's important to make sure that all the duties that the PA is going to do, or the range is put in the practice agreement. So if what the PA was doing was not contemplated, that's why it's important to encompass those duties there. With a question like that, it's hard to know, it's hard to answer something like that without having more specifics, and we don't necessarily want to comment too specifically on something that might end up as a complaint before us. But it's hard to know without the specifics. I mean, a PA shouldn't be practicing outside of the scope of their supervising physician, but it depends on how far outside that is. A physician has a very large scope of practice, so that it's hard to comment on that, but it's important to outline the duties of the physician assistant in the practice agreement, and so then the PA knows what what their duties are and responsibilities are, and that's outlined in the law, that those things should be in the practice agreement.
Is the clinic that the PA is working in required to keep a copy of the practice agreement on file?
That would be a yes. It should always be on file. And in fact, just as part of your normal record keeping, I think the physician assistant should make sure they have a copy in their files, a paper copy, or in their computer files, but have it accessible.
Because now that you're just required to file with the WMC, if we ask your clinic or you for a copy of that practice agreement, you need to be able to provide it for us. So make sure that you or your organization, or preferably both, as Ms. Schimmel said, have a copy of that. This is a little out of the scope, but I think it's a fun question. What about the name change to physician associates in Washington?
Well, it's not going to be happening for a while, mainly because it was a recommendation from the House of Delegates at the AAPA, and now they're going to research exactly how they're going to do that. Some of the literature I've read says that it'll happen within 5 years. I don't anticipate us making any rule changes or law changes in Washington State about that in the next 4 years at least. Jim, what are your thoughts on that? Let me rephrase that, Jim. What are your thoughts about a timeline on how long that's going to take? How long before it changes in Washington?
I will tread carefully here. So my understanding is that there are many pieces to this puzzle. For example, the American Academy of PAs is one player. The National Certifying Body, NCCPA, is another player. PAEA, the educational group of PAs, that's another player. ARC-PA, who also sort of does, plays a big role in what should be in curriculum, what should not. They're a big player, and each individual state is a huge player in this. There are really a lot of moving parts, and I think my guess and the guess of people who know more about this than me is that this could take years, not months. And so I believe the Washington Academy has advised people to not consider the title change final by any means. There are some who are encouraging people, PAs, to just remember that as we describe ourselves.
Yeah, it's going to be a long process as we get through all this, and I would encourage any of you that are interested in helping out with this to consider becoming a commission member in the next few years. It's a great place to be able to get involved in the active change within the medical commission, and there are lots of options for volunteering or becoming a commissioner, things like that. But keep in touch with that and stay tuned. It's going to be for some of us, very exciting, and for some of us, a little scary, because I've been a physician assistant for 21 years. So switching, and it was a big battle back when I was in school in the late 90s. So I think that this name change is going to be, it's going to take some time. We're going to have to first get used to the fact that we're going to be this, and then it's going to be really the challenge and the financial responsibility to figure out how to get this all changed in all the documents and within the lingo, etc.
I think that's well put, Teresa. And I also would say, noting that I speak solely as a medical commissioner, and not on the behalf of anybody else or any other association, and that if there are people who are interested in being part of this process, that I think the Washington Academy of PAs is probably a good place to look for ways to become involved, because they'll be very involved in how this happens as well.
Yeah, that's great, Jim, and they could use your help. They're looking for folks to help them out, and they're looking for some new people there. And if you're interested, reach out to them. I know that they have a lot of positions available.
So does the supervising physician still need to be in a corresponding specialty?
For sure.
Yes, you cannot have an orthopedic physician supervising a dermatology physician. Again, it comes with scope of practice. So your supervising physician and your scope of practice need to reflect.
You know, I think a related question has come up several times. It came up for the commission, and the commission ended up, or actually the Department of Health made a clarifying statement about it regarding people who have PAs who have the Suboxone waiver. And originally the question that came up, can a PA who has a Suboxone waiver, X waiver, can they use that X waiver if their supervising physician does not have an X waiver? And it's the opinion of the Department of Health that yes, in such a situation, a PA can use their X waiver even if their supervising MD does not have the waiver, if the supervising physician is eligible to get the X waiver. And that's sort of a curveball to this whole thing, is that recently the current administration in Washington, D.C. Were able to issue an order that said that's in order to get an X waiver, used to be PAs and NPs had to do 24 hours of training, MDs had to do 8. That now PAs, NPs, MDs, and maybe some other people, I think a few other professions, but PAs and MDs no longer, you still have to get an X waiver to prescribe Suboxone, but there's no longer any training involved. And so I'm thinking still that the clarification from the DOH, from Department of Health about this issue is still standing, although the context is different, because now there's no, I mean, all a PA or an MD in good standing has to do is say, declare themselves and apply for an X waiver, and they get the X waiver without any sort of training. But that's an example, I think an example that sort of relates to the question. I hope it does.
So we have a couple questions centered around adequate supervision. So can you provide any examples of adequate supervision, and who is responsible for adequate supervision, the MD or the PA?
Well, I'll jump in here, and I'd like to have Ariel maybe jump in as well, since she's done so many cases where we've had the discussion about whether there's adequate supervision or not. Really, supervision comes down to the agreement between you and your physician, whether it be MD or DO. You both decide how often you're going to meet. Are you going to meet by telephone? Are you going to meet in person? Are you running ideas by each other? Certainly if you have, complicated cases, or like I tell people, you need to know what you don't know so that you can reach out to your physician as a resource. They've got more schooling than we do. Their knowledge base is different, and being able to rely on them for help is important. As far as signing off charts and things like that, there's recommendations for it all over the place. But the big thing is to make sure you have adequate communication. Your doc kind of needs to know what you're doing. If your doc doesn't know what you're doing, then you are not being adequately supervised. Ariel, what are your thoughts on that?
I'll say that the law does not outline exactly what that is. It says that they're, like we talked about before, that a supervising physician cannot supervise more physician assistants than that they can adequately handle. And so it's a case-by-case determination. The things that Commissioner Schimmels just mentioned are things that the commission would consider if they were to receive a complaint regarding either a PA or if the complaint were centered around a complaint that a supervising physician was not supervising adequately enough, those are the things that would be considered. Generally, when the commission is looking at that, it's when it's a complaint against a PA and perhaps a statement from the supervising physician is asked for in the course of the investigation. And that's one of the things that is looked at to see if a case should be opened on the supervising physician as well. It doesn't happen very often. I think that the PA's conduct would have to be pretty egregious, but it does happen occasionally, the inquiry whether the supervising physician's supervision was adequate. We can look at, one of the things we might look at is records to see whether the supervising physician has signed off on any charts at all. That would be one thing to see if a review has been done at all. But working in the same site at any point, as Commissioner Schimmels mentioned, communication between the supervising physician and the PA, how often is that happening? There could be many other factors, but those are the different kinds of factors that the commission would consider in looking at whether there's adequate supervision.
I think that's really helpful, and I also think maybe thinking a little more broadly about what is, I mean, in medicine or in any other setting, what is good supervision? What is, and I think some of the same common sense answers that go for other professions would go for here. Does the supervisor know what the person they're supervising does? Do they communicate with them? Do they, is the supervisor readily accessible to whoever they're supervising? I think some of those big picture kind of common sense descriptions about what is meaningful, what is good supervision, I think also should be thought of here as well. I mean, the medical aspects make it a little more specific for sure, particularly if there's a complaint. But you know, if a supervising physician doesn't really know what the PA is doing, if they don't communicate with them, if they're not accessible to them, then like in any other setting when you were evaluating supervision, I think those things could potentially pose problems.
Yeah, I mean, you could have a case where the PA is doing everything right. They're reporting things to their supervising physician, and the supervising physician is not being responsive. It depends on the setting. It depends on the kind of practice. I can imagine that in different kinds of specialties, you'd have different kinds of supervision and different kinds of responses that would be needed in different kinds of specialties. So I really think it depends on the circumstances. So definitely a case-by-case determination.
I know in my, I've been doing dermatology for a long time, and the doctor I work with, now I am a bit of an exception because I work in a federal system and not a state system or a private system, but we still are adhering to the AAPA recommendations for supervision. And although I work fairly autonomously and have actually probably for most of my dermatology, after about the 3rd or 4th year of my dermatology career, anything that was fairly complicated, I would CC my doc, just send a copy to it so that they could review it and co-sign it. Super important to do that, I think, especially if you're working with, very complicated cases or polypharmacy cases or, more critical cases, so that your physician can sign off, and that way your doc is kind of looking to see what you're doing and you're sharing with them some of the more difficult cases. I work right next door to my doc. Her office is right there. So if I have a question or a concern, and if she has a question or a concern, we interrupt each other, or we meet the hallway to talk about it, or we do a Teams meeting or an email or messaging through our EHR. It's important to keep that that relationship there. That's what PAs are all about, is that relationship with your MD. So keep it moving. That's the way it is. We're a team. Nobody in medicine anymore is an island. You can't work as an island. It just is not realistic.
So something kind of just piggybacking on that, we have a question of, can you discuss the expansion of power to sign documents? Is the physician no longer required to countersign?
Well, the physician is not required to countersign documents now anyway. I mean, I practice like Teresa. I have the supervising physician readily available, good, whether I have a question, they're never hesitating to ask me about something when they review my charts. But I don't think there's been co-signature as a process here since I've been here, and that's been a long time. But we communicate frequently, we document our communication, we know how important that is to document it, to make sure people know that to make sure that the commission and the whole world knows, if they were ever to come and look into our charts, that we're communicating, we're learning from each other, and that's how it should be. But whether there's co-signature or not, that's up to the supervising MD and the PA. There is, where I work, there is no co-signature, and I think the supervision is really top notch.
Well, and I would like to even explore that a little further, Jimmy, because I think that you don't need a cosign in the state of Washington to sign other things like a handicap parking sticker or L&I forms, all kinds of things. When I was previously involved with WAPA in 2007 or 2006, I can't remember, I'm getting older, we passed a law within the state of Washington where PAs could now sign without having to have a physician co-sign. You should be able to sign all of your documents by yourself. Now, as far as chart notes and things like that go, there may be an institutional policy. Maybe your hospital requires your note needs to be signed, and that's their institutional policy. But there's nothing in regulation or statute that says that you have to do that I'm aware of.
I agree with that.
So are there implications for multi-state work? Does the DOPA need to keep both licenses if they're also working across the border in Idaho or Oregon?
Well, they're not going to be able to keep the DO license, so that's not an option. I don't know what our neighboring states' requirements are for osteopathic PA practices, so they would need to look into that. But our license allows them to have an osteopathic supervising physician, so they should look into whether that's compatible with another state's requirements. But there's just going to be one PA license here.
And it's always been, if you work in another state, you have to have a license to practice in that state. You might be able to write a prescription that'll be filled there. We have that in Eastern Washington particularly, because a lot of folks come from Idaho to the Spokane area to be seen. And we can certainly, the Rite Aid or Super One Foods or whatever will fill a prescription from a Washington State physician assistant. But to actually practice medicine in the state of Idaho, you have to have a state of Idaho license for PA practice. And that's, at least that's my understanding. And the same goes, I know, for Oregon and for other states, Montana, et cetera.
So do we need a practice agreement if we are just per diem?
Yes, you do. If you're practicing as a PA, you have to have a practice agreement.
Is there a maximum distance for a remote site from the supervising physician?
I think it's accessible by electronic means. I can't remember exactly what it says in there. I don't even know if we've just changed that, but you just have to have accessibility. Am I correct, Jim and Ariel?
Yeah, you have to be able to communicate, and the only limit is you have to both be within the state of Washington. So other than that, there are no specific rules about how many miles or anything like that.
Yeah, the language regarding remote site was removed, so.
That's that's an amazing thing, and that's really it's really a big difference. I think some of us are having a hard time saying, really, there's no longer any language at all. It's been such a potentially restrictive thing for so long, and to hear like, do you mean there's no language at all? Saying that's correct.
Well, it
No.
was such a big thing. And remember when we first came up with remote site work, it's like, really? I didn't have to work in the same office as my doctor? Wow, that was really cool, to be able to, gosh, I can go work somewhere else without having my doctor be right there. That was a pretty cool deal back in the day for those of us that have been doing this for a while.
So does the limit of 10 include relationships that a physician may have with a physician assistant in other states? In other words, how many PAs can a physician collaborate with out of state in addition to the state of Washington?
I don't think that's specified.
I don't think it is either. If they've got a license, for instance, we'll use Idaho again since they're so close here. If you've got an Idaho license and you have a practice in Idaho and you have a Washington license, you have a practice in Washington, I would say that the state law would require you to, again, not have any more physician assistants, at least in Washington, than you could reasonably supervise. Ariel, any comment about that or anything that you could imagine? I mean, I can imagine all kinds of scenarios to go with it, but.
So the question was, how many physician assistants can a supervising physician collaborate with out of state?
Yeah.
So
I think the idea is that the out of state physician assistant, that was not their supervising PA. I think that the idea was, if I'm collaborating with other PAs, is that included in the 10 maximum?
this law doesn't speak to that. If that physician is licensed in that other state, I suppose that other state's law might address that. Generally, the practice of medicine happens where the patient is. There may be telemedicine implications that factor into this. We also recently passed a law that talks about, the legislature passed a law that talks about physician to physician collaboration via telemedicine for certain things. I don't recall if that encompasses physician assistants, though. I don't believe it does. So it just this law doesn't speak to that. But I would think that if another state's law allows for that and the physician is licensed by that other state, that might be allowable. This law covers physicians and PAs that are licensed here in Washington.
So we're running short on time, but there are a lot of questions that we didn't get to today, but I will follow up with everyone on your questions by the end of the week. I'll make sure that those get answered. A lot of them are procedural, and one of those, what is the process for changing over to the DO or PA license? How long does it take? The short answer is you don't need to change over your license. You'll just not renew your DO PA license. So I'll there are similar questions to that, and I'll follow up with everyone just to make sure that we're clear on kind of the next steps for you guys. But I wanted to give my panel an opportunity for closing thoughts before we go. So Mr. Anderson, if you have anything else you'd like to say, would you like to start us off?
Well, just that the commission is here for all PAs out there. And, you know, as we wade through this, there will be things like, well, exactly how does that work? And maybe this is something nobody had thought about. And there will be things like that. The commission is here to help us all wade through that. So not to despair.
Sorry, I had a little mute button problem. Yeah, I would agree with Jim. You know, we're here to help, and this is super exciting to have this starting on the line of moving towards the optimal team practice that the AAPA has been talking about, to give PAs better reimbursement opportunities, and to help continue the rural and underserved care that physician assistants originally came out doing. I think this is an exciting law, and we're going to continue to push forward with the AAPA name change. Again, that's not anything that's coming soon, but thank you so much for tuning in today and for allowing us to talk about what we're up to.
Thank you everyone for joining us, and hopefully we'll be able to resolve any remaining questions. And if there are any new questions, go ahead and submit those to us. I think I see Jimmy's email address there, and also at medical.commission@wmc.wa.gov.
Just to echo with Ariel, you can email me any questions you have once you kind of percolate on this information. This recording and the presentation slides will be emailed to everyone later this afternoon once the recording is done processing. So keep an eye out for that. You're welcome to forward that to anyone who wasn't able to attend today. But yeah, if you have any other questions, I will follow up with all of the questions that were asked today, or you can email me, and my email address is on the screen. So I want to thank my panel. Thank you so much, everyone, and I hope you enjoy the rest of your afternoon.